It is always a great pleasure to bring in Dr. Bradley Meyer of the Okoboji Wellness Clinic and visit with us for Wellness Wednesdays. Good morning, Dr. Meyer.
Good morning, Dave.
Well, we're going to talk about organs today, something we desperately need.
Yeah, we do. Silly. You need organs. But it's one of the things that I kind of take note of when folks come in for a sit-down with me to talk about how they're getting sideways and not feeling like they want to feel, brain fog, fatigue, pain, those kinds of things. So one of the things I'll do is I'll sit down and listen to them about what are the different things they've had in their life. And we always talk about toxins, traumas, events, surgeries. What are the surgeries that you've had? And many folks come in and will say, okay, yeah, well, I had my gallbladder out, or I had a hysterectomy, as an example. And I had a couple in yesterday that were like, yep, if it's not working, it's just been yanked. And I kind of get back and reframe things like, yes, we are super happy when we've got our surgeons to take something out that is not working and it's an emergency. Absolutely. But God made that organ for a reason, and it's there to serve a purpose. And yes, the body can compensate when some of these non-essential organs are removed. I will say non-essential because they are essential, but quote, the body can adapt. But a lot of times things change, and the body can't adapt as well as it would like to, and it needs some extra support. And that's what we look to do. So it's like, before, if it's not an emergency and you're seeking consultation about something that has been explained to you that might be related to a dysfunctioning organ, question I'm always going to encourage everybody to ask is, well, what's causing it to not work very well? So if we get rid of that gallbladder, well, what was it that was causing that not to work well? Could it perhaps be that the liver's not working as well as it needs to, and we're developing fatty liver, and it's not detoxifying very well? In many cases, yeah. A lot of liver congestion. How about endometriosis and fibroids? Well, why are we producing fibroids? Why are we having changes in our menstrual cycle? And could that relate back to what could it relate to? Maybe gluten? Yeah, in some cases. Could it relate back to how's my liver functioning? And can we help that liver function better? What can we change lifestyle-wise that's going to help that liver function better? What are we going to take that might help detoxify that liver? And so when you're in, because once it's gone, it's gone. And so like I say, it's not like there's not things we can't do, and because there are, but that's then when the body starts to get out of balance over time. Another big one a lot of folks will have is like, well, I had ulcerative colitis, which is a big-time inflammatory bowel disease. Some people end up having their colon removed. Well, the colon's a really important part of the body for many, many reasons, but it's important in absorption of all kinds of things, including hydration and water. So when that's not there, your small intestine's got to pick up the slack. So short end of the story is that just before, if it's not an emergency, find out why. Because I may see somebody 20 years down the road that the why was never figured out, and then at this point they're saying, oh, I'm really tired all the time, or I've got bloating, or I've got body aches, or I've got brain fog. And it was because of many times what was leading to that inflamed organ was never really figured out or addressed. So that's what we're trying to accomplish when you come into the clinic here. And I would be remiss, Dave, if I did not talk about hyperbarics, because I cannot tell you how important that is to folks in their recoveries, in their wellness journey, and it's like nothing I've ever seen before. When we come in and we sit down with folks trying to get the root cause of what's going on, peel back the layers of the onion, we tend to get there a lot faster when we start doing hyperbaric therapy. So it's a really cool process that, for instance, and I shared that wonderful story about the gal came from Council Bluffs, and I want to have her on so she can share her story about all the different things that she was battling, seizures, what came in a walker and such. She again stayed with us for a full week. We figured that we were like, okay, what was it? What organs were removed? What was it that you were having intake, that you were drinking, or your part of your diet that was inflaming you and getting you sideways? Well, again, with her, rocket fuel. I mean, just popping in that hyperbaric twice a day for 5 days when she was here from out of town, amongst the other approaches, trying to figure out what was getting her sideways, what was inflaming her. That is our goal. And so a lot of times, Dave, folks are going to ask, well, how do I even get started? And because I can't commit to a week and doing 2 hyperbaric treatments a day and all the other modalities we offer through the clinic, we got to do this in a piecemeal approach so we can meet people where they're at. But one of the things I haven't talked about really that is, I think it's important, that when folks are wanting to get started with us here to on this journey of wellness and feeling better quality of life, how do you get started? You can give us a call and make an appointment with me and have a consult, and we can kind of sit down if you are wanting to take the deeper look at things. And that takes a lot of times takes some time. But even before then, before you set foot in the Okoboji Wellness Clinic, call and ask about a discovery consult. And I'm happy. The team will talk to you a little bit about it, and if we can talk on the phone for 15 to 30 minutes to see, all right, before you even set foot in the clinic here, what's a little bit of your background and what's going to be your best approach? So we have a little bit of an idea. You have a better idea of the direction that we might take and the options available in the clinic before you even set foot in the clinic. So that's a big way to do it.
Well, and we can look from our past discussions about what Hyperbarics has done with concussion patients. I remember one of the very first testimonials you told us about was a patient you had that had an open ulcer wound on their leg that healed with Hyperbarics. I mean, there's some remarkable things, and the more research I do on this, inflammation of nearly all of these things, disease-wise, inflammation plays such a gigantic part, and we know beyond a shadow of a doubt, hyperbaric treatment reduces inflammation.
Been seeing it for 2.5 years here. Incredible for inflammation. Soup to nuts, everything from headaches to helping that optimizing that memory to concussions and chronic pain to on and on and on. You name it. And I call it the Great Fire Department. And it is unlike any other fire department that I've seen when it comes to the medical arena when we're talking about knocking down that inflammation. But the big key, and it helps us get there faster, because a lot of times folks are like, I've made these changes in my lifestyle, and I've cut this out, or I'm doing this better, but we're 2 weeks in or 4 weeks in, and we get kind of impatient and frustrated, but I'm still not feeling better yet. So we want to identify what those toxins and triggers are, so the fire department can work even that much better. The hyperbaric can work even that much better. And so you come in and we identify what are all those things that are getting our body out of balance, and those that are, I call them, those arsonists that are out there lighting fires in our body that whatever it may be. If it's gluten, I've used that example a lot, but whatever that toxin is, wouldn't it be great if we can identify it so the hyperbaric can work even better. But then you do get going on the hyperbaric therapy in addition to all the other approaches that we have here to clean the system up and get it into balance. It's like getting you feeling better that much faster. So it's if you're feeling better, then you're more in a short amount of time, you're motivated to keep going and take the next step and take the next step and take the next step.
And if you're 50 years old and you're taking 10 medications a day, how about you get some help, and maybe you do need to take 4, but if you could eliminate a half a dozen, how great would that be?
Yeah, I mean those medications, the side effects that they have with them, in many cases, if you can reduce that pharmaceutical load, that's a great thing.
All right, so how do they find you?
Yeah, give us a call at 712-339-6024 or online at OkobojiWellnessClinic.com. You can find us on Facebook as well. We're at 3305 Berquist Avenue in Spirit Lake, so we're just off of Highway 71. So it's a building that's, we're happy to have you stop in, and we can give you a quick tour if you're, hey, what's this all about that's happening here in Northwest Iowa that's been helping so many people. We want to share the good news. So.
Very good. Dr. Meyer, it's always a great pleasure. Have a great day healing folks, and we'll chat again soon.
Sounds great, Dave. Take care, everybody.
Thank you, Doctor. Dr. Bradley Meyer with Okoboji Wellness Clinic. You can look him up at OkobojiWellnessClinic.com.